Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Here's Eddie Frederick.
So glad you can join us. Grand design for the distribution of AstraZeneca vaccine in Trinidad and Tobago. This story takes the lead in our 1042nd edition of Caribbean Perspective for Wednesday, 3rd February 2021. Details after this break.
Did you know that your friends and family can now shop at the Food Fair from anywhere in the world, and you can receive here in Grenada? The Food Fair and GrenadaMarket.com now make it possible through secure online shopping and personalized customer service. Simply send your loved ones a list of your preferred items or let them fill an online basket, and the items will be available for pickup or delivery. Visit GrenadaMarket.com or thefoodfair.gd today for more details. The new norm. Spread the news.
Welcome back. The Health Minister of Trinidad and Tobago announced the details of what he referred to as a grand design for the distribution of AstraZeneca COVID vaccine. He spoke of a specific plan to address concerns about the elderly in long-stay homes. TV6's Jewel Brown reports.
Persons in long-stay homes in both Trinidad and Tobago, their guardians, children, and the homes will be required to sign off on those medical legal forms, agreeing that we have consent to vaccinate their family members and or charges.
Health Minister Terence Dialsing on Monday, as he said over a month ago, the Health Ministry had been working on concerns with regard to elderly residents at long-stay homes, giving informed consent to be among the first 50,000 people to receive the Oxford AstraZeneca vaccine in Trinidad and Tobago when that COVID-19 vaccine arrives.
The nature of the individual that normally housed in these homes, unfortunately, they are very ill, they are very immunocompromised, and they are close to the sunset of their lives. And what we don't want is to administer a vaccine today, and then tomorrow the individual unfortunately passes, and then we make a link, however tenuous or untrue, between the vaccine and the death of that particular individual.
Minister Dialsing outlined what he called the grand design of the distribution of the AstraZeneca COVID-19 vaccine, set to target 50,000 people in the first part of Phase 1.
Using the COVAX concept of equity, the first batch of vaccines will be used solely in the public healthcare system. In the first phase, all healthcare workers who are willing to be vaccinated, the most vulnerable, whether that vulnerability is through economic circumstance, social circumstance, the most vulnerable, the most exposed will get a first shot, a first tranche, a first bite at that vaccination cherry.
Minister Dialsing said depending on the rollout of the vaccine in Phase 1, essential workers such as police, firefighters and sanitation workers are also to be included. He said depending on the amount of the first tranche of vaccine doses left or if new ones arrive, the mass vaccination program would begin.
We'll be working with the Trinidad and Tobago Medical Association to man about 3 or 4 mass vaccination sites throughout the country. We are not starting with mass vaccination sites in the first instance because we want to get the experience. We want to know if there are any side effects as rare as they could be and how to treat it.
This will be followed by further COVID vaccine rollouts through village outreach programs and then in private hospitals. The Health Minister said Trinidad and Tobago has the capacity now to store 390,000 doses of the AstraZeneca vaccine based on the temperature requirement of 2 to 8 degrees at NIPDEC, the Arima General Hospital, the Point Fortin Hospital, and in Tobago.
The first tranche of 100,000 to 117,000, 120,000 will go to NIPDEC in the first instance for storage and roll out from NIPDEC in that first phase via the public healthcare sector.
Jewel Brown, TV6 News.
Meanwhile, Trinidad and Tobago has become approved for the AstraZeneca vaccine because there is a shortage of the Pfizer vaccine, and decisions have to be made about who gets Pfizer and who gets other vaccines, says the WHO PAHO representative to Trinidad and Tobago. Jewel Brown of TV6 News again reports.
Trinidad and Tobago has qualified via its readiness to receive the vaccines, to receive the AstraZeneca vaccine in the coming month.
Dr. Erica Wheeler, the Pan American Health Organization and World Health Organization representative to Trinidad and Tobago, as she said the AstraZeneca vaccine will be delivered through a PAHO revolving fund.
At this time, the vaccine that has been approved by WHO for quality, safety, and efficacy has been the Pfizer vaccine. And the next vaccine that will be approved would be the AstraZeneca vaccine.
Dr. Wheeler said Trinidad and Tobago has met the requirements by regional and international committees reviewing its readiness and received their approval for the AstraZeneca vaccine.
The reason why Trinidad and Tobago is receiving these vaccines, as it said in the communication we received, is that there is a shortage of the Pfizer vaccine. And decisions have to be made about who gets Pfizer, it's limited, and who gets other vaccines.
The BBC is reporting that Germany says it will only offer the AstraZeneca vaccine to 18 to 64-year-olds because there was not enough data on how it affected the over 65s.
In terms of the efficacy of the vaccine, I know people may wonder if it's safe, if it's of good quality. We want to assure you, as PAHO, the same rigorous system for approving the Pfizer vaccine was and is continuing to be applied to all vaccines that will be approved by WHO. Although the preparation might be different from the Pfizer vaccine, this does not mean that it is not safe or it's of a different quality.
The Reuters news agency is reporting efficacy of 95% of the two-shot vaccine from Pfizer BioNTech approved in Britain, compared to interim data showing AstraZeneca vaccine's efficacy in preventing symptomatic infections was 70.4%.
This one also is a double dose, but Johnson & Johnson, for example, is a single dose. As to the efficacy, you may also know that the flu vaccine has a variable efficacy of between 40 and 70%, yet all countries of the world take the flu vaccine. So this is not a case of a second-class vaccine.
Dr. Wheeler said the AstraZeneca vaccine has already been reviewed by what she called the several stringent regulatory authorities.
And it is now with the European Medical Authority, from which WHO also heavily depends to give its emergency use listing. This information was received by Trinidad and Tobago this weekend on Saturday.
In a statement last Friday, the European Medicines Agency announced it has recommended granting a conditional marketing authorization for COVID-19 vaccine AstraZeneca to prevent coronavirus disease 2019 in people from 18 years of age. Dr. Wheeler said PAHO has been working closely with the Health Ministry to support its readiness for its COVID vaccine rollout program in Trinidad and Tobago. Jewel Brown, TV6 News.
You're listening to Caribbean Perspective with Eddie Frederick.
The question is asked in St. Lucia, can the penal system there handle an outbreak of COVID-19? Solage Alfred of HTS News Force has that story.
The Body Lake Correctional Facility has confirmed the presence of the virus at the prison complex. According to Director of Corrections Hilary Herman, the highly secure facility first witnessed the introduction of the virus among staff in the kitchen, to be precise. Now, 8 inmates have tested positive for COVID-19. Herman says the health authorities conducted contact tracing efforts on the weekend and the results are pending. In light of the threat, can the prison endure a shutdown?
We're as tightly shut down as we possibly can. There's no inmates going to court. Everyone is staying within, and that has been like that for months now. We've attempted to do virtual visits
A now viral online video shows some inmates at the facility leveling a number of allegations at authorities concerning the potential threat of the virus to the prison population. In the video, the inmates can be seen skirting COVID-19 guidelines and sharing paraphernalia.
The authorities cannot inform us as prisoners up to this date as to what is really taking place in the prison. All we can see, we can just clearly see movements of people going around with corona gear, corona equipment or whatever it may be, and we as prisoners, they never come to teach us any precautionary measures. They never come to, no medical practitioners never been to us and tell us, well, such and such is the case, well, we need to abide to these things, or we need to use protocol or whatever it may be. And
the Director of Corrections notes the fears and anxieties of the prison population.
Those videos are obviously not condoned by us, but however, what you see in this video is inmates that are scared, high level of anxiety, and they're concerned. However, we continue to update them on what the virus is doing, but as you know, unless you have the CMO herself come out to the prison and explain to them, they probably will not be satisfied.
Officials have kept close tabs on prisons in the region, which have suffered similar fates. In early January 2021, over a quarter of the prison community in Barbados had contracted the virus. Likewise, a spike in cases in Trinidad and Tobago back in November 2020 caused a stir among corrections officers and prisoners there. Meanwhile, St. Lucia's acting national epidemiologist, Dr. Dana Da Costa Gomez, reveals that the positive cases were found after 35 individuals in the prison system were tested.
In response to recommendations from the Ministry of Health and Wellness, the following actions have been taken in the interest of containing the spread and protecting the health of staff and inmates at the facility. Complete isolation of confirmed inmates away from the general population. Quarantine and testing of close contacts of the confirmed cases. On Saturday, January 30th, 2021, samples were taken from a total of 86 individuals, 79 inmates, and 7 custodial staff. The Ezra Long Laboratory is currently processing these samples.
Dr. Gomez says strict infection and prevention control measures will be enforced in the wake of the cases.
Isolation of any symptomatic inmates. Placing of exposed inmates into a limited number of areas whilst establishing effective barrier controls between them. Protective measures for inmates who fall into high-risk categories. The use of adequate personal protective equipment by the healthcare staff and custodial staff who will be caring and working with the quarantined and isolated individuals. Limitations of the movement and interaction of custodial staff overseeing areas with inmates. The strict adherence to hand hygiene measures. Continued use of face masks by staff and inmates. The frequent cleaning of high-touch objects and surfaces. The testing and quarantine of all symptomatic custodial staff.
Public health officials vow that the situation will be monitored and assessed continually to ensure containment of a possible outbreak. Solange Alfred, HTS News Force.
Sections of Guyana were rocked by an earthquake with a magnitude of 5.7 on Sunday afternoon. According to the Civil Defense Commission, the CDC, it received reports of an earthquake of shallow depth of 10 kilometers with the epicenter near Boa Vista on the border with Brazil, which occurred on Sunday at 3:05 p.m. The United States Geological Survey listed the earthquake as 5.7 on the Richter scale and located the epicenter at 83 kilometers south-southeast of the town of Lethem. According to the CDC, shallow earthquakes are felt more strongly than deeper ones as they are closer to the surface. The Regional Emergency Operations Center reported that the tremor was felt in Region 9, but there were no reports of any losses or damage. The The CDC says that it will continue to monitor the event through the National Emergency Monitoring System and provide updates as more information become available.
I am Eddie Frederick. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.